Former Surgeon General Regina Benjamin stated that, quote, "Oral health is much more than just clean teeth. It refers to the health of our mouth and reflects the health of our entire body," end quote. Oral disease, although nearly 100% preventable, continues to affect children, adults, and families across Minnesota in excessive numbers. While oral health is a crucial part of our overall health, it is often overlooked and underappreciated as a health concern. Many people lack an understanding of what creates good oral health, and many also lack access to oral health care. Oral health is a public health issue of major proportions. Because of that, on today's episode of A Public Health Journal, we're going to focus on oral health and what's being done to make it a higher priority. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at the state of oral health in Minnesota. In particular, we will be looking at some of the data that are available to help define the scope of the oral health problems in Minnesota and what's being done to address some of those problems. Joining me in this conversation is Susan Hammel, Executive Director of the Delta Dental Foundation, where she is active in helping to provide access to oral health for the underserved, make the connection between oral and overall health, and explore innovative social investment tools and models to achieve true system change in oral health services. Susan, welcome to our program.
Pleasure.
I'm glad you're here because oral health is sort of the Roger Dangerfield of health, I believe. Isn't that the case?
It's so true. People always forget that the mouth actually is connected to the body.
Yeah. And so what is the state of oral health in Minnesota?
Well, you know, like a lot of health statistics and health conditions in Minnesota, we're doing great compared to the rest of the country in a lot of measures in terms of preventative care for oral health, in terms of how many people are seeing a dentist. We're doing well compared to the nation as a whole. However, it's when you start to look into the data by county or by poverty rates that you see that drastic health disparities exist in oral care in Minnesota.
Well, and I know that the Delta Dental Foundation has partnered with the Minnesota Department of Health to create a portal so they can actually look at some of those data. How did that come about?
Well, you know, Commissioner, you can't solve a problem if you don't know it exists. So facts can empower people to find solutions. So the Minnesota Department of Health, the Oral Health Program, actually approached us at Delta Dental, knowing that we are the biggest provider of dental benefits in the state, and we are committed as a nonprofit to helping people get access to affordable, high-quality care, everyone in the state. So the Oral Health Program contacted us and said, we need to have some more oral health statistics so we can measure where the problems are, and then we can help drive solutions.
Right. Well, we've got some slides here that sort of demonstrate the portal. We figured we wouldn't go through it actively, but so here's the homepage. Tell us what we see on this homepage from the oral health portal.
Exactly. So this is the homepage where people can access oral health data, and they can find statewide data, and they can also look up their own county to see how they stack up against the whole state of Minnesota.
And we'll give links on this show to this page. So then from that, you can click on, and let's look at one of the prevention graphs that we have.
Exactly.
And so tell us what we're seeing here.
Okay, so when you look at the top, the figures, you can see that Minnesota is doing great on sealants. And dental sealants are those plastic coatings that dentists put on the back of your molars to prevent cavities. So we're doing great. Pat ourselves on the back. Minnesota's got 64% of our kids in 3rd grade have dental sealants versus only 23% in the United States. So great, no problem, right?
Then, we're all above average.
And we're above average, exactly. Then you look at the bars, though, and then you see in the light blue, in the untreated tooth decay, so that means those untreated cavities in the kids' mouths, 12% in a high poverty school versus 12% in a low poverty school versus 67% in a high poverty school. So that means if you're a child and you're a 3rd grader in Minnesota, you're not doing so great if you happen to be in a high poverty school.
All right, so that shows in Minnesota we have some of the greatest disparities in the country in a whole variety of ways. And so it's playing out in dental care just like it's playing out in infant mortality and cancer statistics.
Absolutely, and if you're a kid at school, how are you going to pay attention and learn and stay in school if you have a cavity and your mouth hurts? It's actually the #1 reason kids miss school.
All right, so we got another slide here about dental care. So this is dental care in the United States and in Minnesota. Tell us what we're seeing here.
Well, once again, Commissioner, you said it. We're above average. More people in Minnesota are getting to the dentist than in the country as a whole. So that's great. Pat ourselves on the back.
Now the next slide. Let's see what that shows.
Yeah, so the same story exists. So in the high poverty schools, fewer people are actually getting in, and these are adults, getting in to see a dentist than in the low poverty schools. So it's a real problem. It's very much correlated with your income level.
So what other kind of data is on this portal? How can people use the portal?
One great way to use the portal is if you're a member, if you're a teacher, if you're a principal, if you're just a person in your community and you're wondering, how healthy is my community? You can actually put in your own county, wherever you are in the whole state, and see how your own county ranks compared to everybody else. And then that could help you make some good decisions about where to invest resources. For example, with dental sealants, it could help a school decide, we should have a sealant program right here at our school.
So what's on what kind of data are there and what kind of data are not there that you would like to see on it? Because I'm sure it doesn't contain all of the data that you'd like to see.
Oh, absolutely. This is just the beginning. It took 3 years in the making, but what we want to see is some more information about older adults, because actually it's our senior citizens who are also suffering from these disparities in oral health care. So we would like to see some information about older people on the portal.
So where do the data come from? How do we collect these data?
Yeah, well, the Minnesota Department of Health finds the data from the CDC, the Centers for Disease Control. They actually run surveys. It's called a basic screening survey of 3rd graders. And we'd like to see a basic screening survey of older adults too. So this is all based on scientific clinical protocols for data collection.
Do other states have portals like this?
That's a great question. Actually, we're the only one that has a portal quite like this. Only 3 states even include anything about the mouth in their public health statistics. Ours is the only portal that also cuts it by county, which is so important to show those disparities. And ours is also the only one that shows it relating to all these other chronic diseases, because the health of your mouth, as you said in the opening, really relates to the rest of your body.
Oh, so we are above average in a whole variety of ways. All right, well, we're going to take a little break, but what we have teed up here is a video that you made available to us from an event down in Mankato where people were lining up to get dental care, and it's about a 4-minute video that shows a whole variety of issues related to oral health in Minnesota that I think is quite informative. So we'll take a look at this video and then we'll come back after and chat about that and some of the other issues that we really need to address in Minnesota. So let us take this little break.
The only insurance I have is Medicare, and that does nothing for dental.
We don't have dental insurance. We all need it to be seen, and this is a lot cheaper for us.
I haven't had very good teeth for many, many years.
Well, I work part-time, don't have medical coverage. I want my wisdom teeth looked at. Hopefully, if they do pull them, that would be awesome.
A couple months ago, I found out that I'm getting the opportunity to have a surgery done, which is going to reverse my diabetes. But one of the requirements for that is to have my teeth fixed. Now I'm getting the opportunity to get my teeth back and reverse some of my health issues. That's something priceless. Honestly, I never would have thought that any of this would have happened.
there's a grave problem in dentistry in Minnesota, and we're here helping those patients get the care that they need.
It's wonderful to have the event back in Mankato. It's just really, really nice to see the community come together and provide care for so many people in need.
Every year we get better. Every year we get more organized. There's fewer things that we wish we had.
There is no way that we could ever put on this program without the financial support of many, many companies and individuals.
Imagine going to a job interview if you're missing your teeth. Imagine trying to function at work if you have a terrible pain in your mouth. And it might be people who are working 2-3 jobs and they just don't have dental benefits and they really need to get their teeth taken care of.
There have been people that have waited overnight, over 24 hours in line to be seen today. That's how bad the problem is in Minnesota.
I'm looking forward to a great 2 days down here of addressing the needs of many, many individuals.
I had x-rays and a cleaning and then this tooth removed up here.
I had 5 teeth missing in front and 2 on the bottom. They pulled one and they put a partial in.
I had a checkup and cleaning. Jonathan had sealants, cleaning, x-rays, fluoride.
And I got top dentures right away that same day. So I'm super happy.
People with good dental care are healthier people. That's good for them as individuals. They lead more full lives. But we also know they're better learners, they're better workers, they're better members of the community. So this is a critical issue in Minnesota.
The volunteers are the mission, and we cannot really do anything without that passion that they have.
And I think that's one of the opportunities that really is really remarkable, is the volunteers that take time out of their life, take time away from their families, take time away from their jobs to volunteer to give back.
You know, I feel like I've been in church for 3 days because I feel like there's such a feeling of goodwill that floats above the surface of all of us. It's wonderful.
I've talked to people who are here because they said they want to go on a mission and they didn't want to go to Africa, so they came to Mankato to help people here who don't have access to oral health.
Quality dental care has other health ramifications. This isn't the ideal way to address that challenge.
Volunteer care isn't a solution to access to care. It's one component, but certainly if there's a way that we can alleviate pain and suffering and get somebody on where they're feeling better about themselves, you know, I'm here.
Welcome back. We're talking with Susan Hammel, Executive Director of the Delta Dental Foundation. Susan, that was really a powerful video in a whole variety of ways. Tell me a little bit about how this came about and who made the video and sort of how it's being used.
Well, this is another one of our statewide partnerships with our key partners, Minnesota's dentists. This is the Minnesota Dental Foundation, which is the foundation of the Minnesota Dental Association. And every year, once a year, they put on this mission of mercy to draw attention to the Rodney Dangerfield of healthcare, to the health of your mouth and the lack of access.
Yeah, and certainly the first part of this show, we talked about the data, but the data are just really the stories with the tears taken away. And in that video, you see lines of people without care, without access to care, and all different kinds of people, from old to young. And so what are you learning from that, and what are people taking away from this kind of video?
Well, one of the things we're learning is that now with the Affordable Care Act, kids are covered under the pediatric dental benefit. So kids are getting in to see the dentist, and there's Give Kids a Smile Day, which is another initiative of the Minnesota Dental Foundation. But who's not getting help are older adults and then just working age adults. So they end up going to the emergency room for dental care when there's not a mission of mercy. And really, that's the worst place to go if you need dental care. You really need to get in to see a dentist, and most hospitals don't have a dentist in the emergency room.
Yeah, well, that's what I thought was actually the most, for me, as somebody who looks at systems towards the end, they said, this is not the way that we should deliver dental care. Yes, it's really a good thing to do, it's really needed, but just like you say, having a couple days a year to give emergency care or emergency room, what else do we need to do to actually get care done in a more proactive and positive way than these Mission of Mercy and emergency room care visits.
Well, we at our foundation, the Delta Dental Foundation, we really are looking at a three-pronged approach. Number one is the safety net, and Mission of Mercy is part of that. But there are these community-based clinics all throughout the state and throughout the Twin Cities. So we're working to help them deliver more care to more people through really workforce innovations. So we look at the whole dental team. We look at the dentist, we look at the dental assistant, the dental hygienist, and this new profession called a dental therapist, which is kind of like a nurse practitioner level, and is a new member of the dental team. So that the workforce is really where some of the innovative solutions can come.
All right, I want to get to that, but first I was still want to focus on some of the problems. As we saw in that video, you know, all different kinds of people. And from the data that you showed, you know, if you're in a poor school, you have more dental problems. What are the populations most at risk for poor oral health in Minnesota?
Well, really, in greater Minnesota, most of the state really is at risk because of the lack of access. There are also neighborhoods in the Twin Cities where people are at risk with lack of access. The other population, we talked about older adults, they're at risk. The other would be special needs. People of all ages with special needs can have a really tough time going to the dentist, and there are resources for them. So special needs population, and then the immigrant population. Some people who are new to our country, they actually sometimes arrive with good or decent oral health, but after 1 year, unfortunately, of the American diet, that changes, and they need to be in with dental care along with all the rest of us.
Is the overall health of the oral health in Minnesota getting better or worse, or is it staying about the same?
Yeah, well, we're seeing actually a decline in utilization, so fewer people are going in to see the dentist, and so we're really looking at this issue of access, and our foundation is dedicated to helping everyone be able to afford to go to a dentist, everyone to get the care they need.
Even with the Affordable Care Act, you mentioned that it is a visit is paid for.
Yeah.
Are we seeing the benefits of that, or is it because people just don't think about oral health care as part of regular health care?
Well, I think all of those factors. One thing we are working to do is get kids in to see the dentist by the time they're 1 year old. That's a recommendation by the American Dental Association, dentist by 1. And so to actually get babies in to see the dentist. So those good habits, those brush, you know, twice a day, floss, see a dentist once a year, those good habits, if they can start really early, they can make a huge impact in your life.
Speaking about really early, how about pregnancy? Is that an issue? I mean, do pregnant women need oral health care?
Absolutely. It's really important that pregnant women do, and in addition, because a cavity is actually an untreated bacterial infection. So you just don't want to have those infections untreated anywhere in your body, and not in your mouth either when you're pregnant.
All right. Well, we're going to take a little break, but then we're going to come back, and I want to talk about, you know, where do we go from here? What needs to be done? So we'll be back right after this message.
You're doing great. We're gonna try this again, okay?
Okay.
Wheels, pedals, handlebar, brakes. Sit up straight, keep your weight in the center, keep your eyes on the road, hands on the grips, button the seat. If we feel ourselves falling, what do?
Just keep pedaling.
Good girl. Now remember, it's all about balance and steering. Steer with your hands, steer with your body. Steer into the corners and you stay out of trouble. And the bell's your buddy, so go ahead and ding that. All right, you ready? Here we go. Pedal, honey, pedal. There you go, you're a bike rider.
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
Welcome back. We're talking about oral health in Minnesota with Susan Hammel, Executive Director of the Delta Dental Foundation. Susan, let's talk about what we need to do to move forward. And we started a little bit about the workforce. And I know that you know, we have so many dentists and we have so many dental hygienists. We now have this new group called dental therapists. Mm-hmm. How do we maximize the benefits that each of those professions bring to Minnesota?
Well, everything starts with a dentist. You know, you have to have a dentist to be able to work with and supervise and have these collaborative agreements with all of these professionals. So we need to get more dentists into greater Minnesota and into parts of the Twin Cities where they're most needed.
Do we have enough dentists overall, do you think?
You know, I think it's a distribution problem.
Okay.
And actually in Minnesota, we have 10 counties in the state where there are dental deserts, where there's one dentist or no dentist. Okay. So we really need to help dentists move throughout the state. One of the things we're doing is we launched a loan repayment for service program so that dental students can get their loans repaid if they move out into one of these high demand, high need areas.
Right. So what about dental hygienists? I mean, they are well trained. Can they function independently, or do they have to be in the same place where the dentist?
Well,
or could
they need to have a dentist who's supervising or in a collaborative agreement, but then they can go and operate somewhat independently, and then dental therapists can as well. The idea is to get everyone on the team operating kind of to the top of their scope, if you will. So everyone playing to the height of their ability, and that's really where the answer lies. Besides in prevention, you know, all of us can take care of our own oral health by brushing and flossing, seeing a dentist, drinking our good Minnesota tap water, which has fluoride in it. Those are all the preventative measures that we can take to take care of our own health of our mouth.
Now I want to talk a little bit about the dental therapists, because you know, we have a workforce issue in the state in a whole variety of areas. This is a new profession, but it may also be some place for kids who are looking for a field to go into. Tell me a little bit about dental therapists.
Absolutely. This is a great track for hygienists, dental assistants, and anyone who may be becoming, just like becoming a doctor is a really high bar for some people. You can become like that nurse practitioner in healthcare, and then in dentistry you can become a dental therapist. There's still, you know, you have to have a lot of science and credentials and a lot of practice. So there's very stringent quality standards for a dental therapist, but it is more within reach than the cost and the time to become a dentist.
What about in primary care? You know, we have pediatricians and family medicine docs who are looking in mouths. Do they have a role to play in dental care?
That's actually one of the projects we're working with another partner. It's called the Cedar Riverside Clinic here in Minneapolis, where they're actually using our grant funding to take a dental therapist and put them right into the pediatric clinic. And they're also going to work with the adults with diabetes, because there's a real correlation between the health of your mouth and then having diabetes.
Well, and we also know that a whole variety of oral health issues actually impact pregnancy, low birth weight, heart disease, a whole variety of issues. So they're really linked in ways that people don't really recognize.
You're so right about that. So we've actually been working with clinics throughout the state on a medical dental integration project.
Cool. What about schools? I know when I worked for the Minneapolis Health Department, we had school-based dental programs, and we did sealants in schools.
Yes.
How are schools being used for oral health?
Well, schools are a great kind of delivery device for particularly those schools that have a lot of poverty. It might be very difficult for kids to get to see the dentist. Parents have to take time off from work to get them there. Transportation might be difficult. So we're actually working with the Minnesota Department of Health's oral health program to bring the sealant program to the school. So right there in the school, a school will take and set aside their auditorium or their gymnasium, turn it into a dental clinic for a week, and they'll get that kind of preventative instruction on oral health hygiene, on how to take care of your teeth, as well as actually getting a dental sealant or something called fluoride varnish, which is when they paint it onto your teeth to get the fluoride right onto your teeth. It's a very effective preventative measure to avoid cavities.
Tell me a little bit about that. I know that you know, a lot of people are talking about fluoride varnish. Could be done in a physician's office, you know, a pediatrician, family medicine. It doesn't have to be done by the doctor itself. Him or herself. Could be done by a nurse or an aide, and it could also be done in schools?
It can be done in schools, absolutely. A hygienist or any dental professional can train you how to apply the fluoride varnish. It's really painting it on teeth. So anyone can do it in a school setting, also in a nursing home setting. So the nursing home staff could be trained.
So fluoride varnish is not just for kids?
It's not just for kids. There's some studies that show that monthly application of fluoride varnish for older adults greatly improves their oral health.
Good. Well, and I know we have one last slide that we haven't gotten to that we should probably put up now. It just shows of where you've been working with the foundation. Tell us what we're seeing here.
Actually, we are the only statewide funder for the biggest statewide funder for oral health in the country, really. So we're dedicated here to the people of Minnesota to increase access to oral health for underserved communities. And what's exciting about this map is it shows that we really are reaching greater Minnesota. We're doing a lot in the Twin Cities, but we are reaching these other communities with the medical dental integration. We're doing that up in northern Minnesota and southern Minnesota and western Minnesota. We're funding projects with workforce innovation to get these dental therapists out there to really get more dentists into those dental deserts as well.
All right, so what's the final message that you want to give to our viewers about oral health?
Yeah, well, the final message I'd say is to take charge of your own oral health and take good care of your mouth and look at your community and take advantage of the resources at the state and at the Delta Dental of Minnesota Foundation and let us know your innovative ideas of how to solve this problem.
Great. Well, Susan, thank you very much for being with us. This is very informative.
Thank you.
I'll be back with a closing comment right after this message.
Spend 15 minutes watching online videos like this one.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes twice a day. They have the time.
The first Surgeon General's report on oral health noted that oral health means much more than just healthy teeth. It means being free of chronic oral and facial pain, oral and throat cancers, birth defects such as cleft lip and palate, and scores of other diseases and disorders that affect the mouth and surrounding areas. This broader definition emphasizes that oral health is core to the enjoyment of the very essence of our humanity, the ability to speak and smile, sigh and kiss, smell, taste, touch, chew and swallow, and convey a world of feelings and emotions through facial expressions. And the report also noted that oral health is integral and essential to general health. Oral and general health should not be viewed as separate entities. Children need to learn that oral health is as a critical component of health as we as adults must also ensure that dental health is included in the provision of general health care and the design of community and public health programs. The Surgeon General's report also identified what we can do to maintain and improve the oral health of ourselves and our children. Individually, we need to include daily oral hygiene activities like brushing and flossing, and make some lifestyle behavior changes like limiting pop and sweets and eliminating the use of tobacco. On a community level, we need to support programs such as community water fluoridation, tobacco cessation, and providing healthy food and beverage alternatives for our kids. We also need to assure access to regular dental screening examinations and the use of appropriate dental advances like dental sealants. Oral health is as important as any other part of our health. If we are to be balanced and healthy people, we need to work to be sure everyone gets good oral health care. The importance of oral health should be evident to each of us every time we see someone smile. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.